I want to go through this checklist with you if we could, and then relate those things that are relevant to Mr. McCord based upon your review of all of the records. Okay?
Yes, sir.
One of the things, talking about feelings of hopelessness, was that consistent in the record that Mr. McCord actually expressed he felt hopeless?
Yeah, in multiple instances, yes.
What's the next one?
Impulsive or aggressive tendencies.
Was that relevant or material to Mr. McCord?
Yes, I believe it was. Not aggressive,
Sure.
but impulsive.
Impulsive.
Yes.
And can you share with the members of the jury, when you say impulsive, what does that mean?
A propensity to act before you think.
All right. And the next one is a loss, relational, social, work, or financial. Did Mr. McCord have issues with respect to number 3?
Yes, sir.
Can you share that with the members of the jury?
Well, at a certain point, I believe his wife had made clear to him that, if he didn't get it together, she was going to leave him. He'd been out of work for a while, so I'm not sure you can call it an acute stressor. Yes, so he had legitimate boss issue.
But let's clear this up, because I don't want to leave anything with the impression. You read Miss McCord's deposition.
Yes.
All right. And what she said, she was telling, she wanted him to get clean. They had been married for a while, and she had never seen him in that state, and she wanted him to get help.
Right.
Correct?
I think what she said was she was frightened. She'd never seen him suicidal like this, and wanted him to get the help and to then be a husband to her and a father to their child.
Absolutely. All right. I wanted to make sure that was clear.
Yes, sir.
And in addition, what about physical illness?
A major physical illness can increase one's risk for suicide. In this particular instance, as the result of his using of drugs, Mr. McCord had developed what he thought were serious medical problems with his arms. The workup had been negative. They weren't able to find an organic basis for those complaints. But he was very much convinced, and this is where the OCD comes into play, that he had something terribly wrong with him medically.
All right, so you got these, you're looking at these, and then when you're the psychiatrist, you train to protect these folks, you're getting all of this information, right? Because
Yes.
you got to get a history, right? We'll just talk about the first 1, 2, 3, 4. What does that do with respect to the psychiatrist's mindset when they are taking care of this patient?
Well, they're already in the mindset that this is a serious situation, and this raises more red flags.
Just another red flag.
Or maybe 2 or 3.
All right. Isolation, a feeling of being cut off from other people. Was that relevant to Mr. McCord?
What you often see in people who are end-stage drug abusers, which this gentleman was in my estimation, is your world falls away. Your primary relationship is with drugs. And so he was still had his wife in the picture and his child, although he frequently wasn't with them, but he was quite isolated otherwise.
All right. Because you read the deposition testimony, like you said, of Ms. McCord, and you've seen all the medical records in the case, right?
Right. She didn't want to be around him, and I certainly understand
at that point in time.
Right.
But the point is, there was indications in the record that Mr. McCord had told psychiatrists that he had been using certain...
Your Honor, leading?
Assistant.
Sure. I'll rephrase it. Did you see indications in the record where Mr. McCord had told psychiatrists that he had been taking drugs for a period of time prior to Ms. McCord being informed by her husband that he had been taking drugs?
Yes.
Okay. And in addition, did you also read and see in the material that you reviewed that Ms. McCord didn't even know that he had been utilizing certain drugs until he confessed to her that, baby, I got a problem?
Right.
All right. leading up to the entering of Delray Beach Medical Center, Fair Oaks, and Renaissance, correct?
That is correct.
All right.
That's the series of events, as I understand.
All right, now, let's go to the next one. Previous suicide attempt.
Yes.
Had, as a child, when Mr. McCord was still a teenager, was there anything in the record and in the materials that you had reviewed where Mr. McCord had made a previous suicide attempt?
Yeah, sort of out of left field, he took 100 aspirin and 24 Tylenol, was admitted to the hospital, was admitted to the intensive care unit, treated.
Is that another red flag?
Yes, a prior suicide attempt is a risk factor for future successful completed suicide.
Now, I don't want to leave any misimpressions. We talk about a history of drug abuse. When you reviewed records, did you also see periods of time for years where Mr. McCord was in a stable condition in not using drugs?
Yes, sir.
And being productive when getting the appropriate psychiatric care and his medication was managed appropriately?
Yeah, he had prolonged periods of sobriety and mental health.
All right, and we're going to go through specifically when I just didn't want to leave any misimpressions. The next thing here is history of mental disorders, particularly clinical depression.
Right.
Is that also relevant to Mr. McCord?
Well, yes, it is.
And he had a long history, since he was a little boy, of a mental disorder and clinical depression.
He had a long history of mental disorders and then also of depression, that's correct, clinical depression.
Is that another red flag?
It is.
All right. Now, there's no evidence of family history of maltreatment. Came from a very good family. No
I'm not
evidence.
aware of any significant history of abuse, that's correct.
All right. So that one's not applicable. The next one, history of alcohol and substance abuse withdrawal. Is there any evidence of that in the case?
There is history of abuse, and I believe there's also evidence of withdrawal, particularly a number of days after he was admitted to Delray, then to Fair Oaks, and then subsequently to Renaissance.
All right. Now, while Mr. McCord obviously was in Delray Beach Medical Center, then at Fair Oaks, did he have easy access to lethal methods?
No. I mean, one is an emergency room. They had him on a one-to-one sitter, direct observation, and then he was committed to a psychiatric facility where I'm assuming vigilant about making sure that folks did not have access to that kind of stuff.
And had the appropriate standard of care been provided, and Mr. McCord got the standard of care that he was entitled to, would he and should he have had access to a legal method to harm himself when he was transferred over to the Renaissance?
If he had received the appropriate care
Absolutely.
at Fair Oaks?
No,
Okay.
at the Renaissance.
Okay. If he had, well, the appropriate care was probably to send him somewhere else
All right,
that
let's-
could do the types of things that were necessary.
But assume, for the sake of argument, we're going to discuss that.
Yes, sir.
What their options were if they did practice within the appropriate standards of care to protect his safety. But just assume, for the sake of argument, that they didn't want to transfer him, and like they told Ms. McCord, and they told Tom McCord's mother, bring me the 14
Objection, Your
hours.
Honor. Counsel is testifying.
Sustain the objection. Just
Yes, ma'am. Yes, ma'am. Just assume, for the sake of argument, that they decided that they could take care of him in this dual diagnosis facility. You with me?
I
I
am.
want you to assume that for my question.
All right.
All right. If they were acting within the appropriate standards of care to protect the safety of Mr. McCord, would he and should he have had access to lethal methods to harm himself?
If they accepted the patient into their care, given the facts of this case, then he should not have had access to lethal methods.
All right, that's my point. All right, so let's go to the next one. Barriers to accessing mental health treatment.
Actually, you skipped one.
I'm sorry, I sure did. I apologize. Family history of suicide. Is that relevant and applicable to Mr. McCord?
A family history of suicide is a risk factor for suicide if they're first-degree relatives, which is the case here. The family history was that the uncle had committed suicide.
All right.
So that's a risk factor for Mr. McCord
And so
in this assessment of risk factors.
All right. And we'll discuss that also. The next one, barrier to accessing mental health treatment. Was that in any way relevant?
I don't think that's a relevant factor.
He had access to health care treatment.
Yes, he did.
And why is being a male a risk factor for suicide?
Because it is. Men are much more likely to complete suicide than women are.
And that's known in
It's
your
just a statistical
field?
fact, right? That's the way it is.
And that's the standard of care that psychiatrists go through in your field?
Yeah, I would expect a third-year medical student to know that, and the majority of these on the board.
And why is it, the next one says Caucasian race, why does that matter?
It is a statistical fact that Caucasians are more likely to successfully complete suicide than are African Americans, Asians.
Latin, Hispanics?
Yes, sir.
Okay. All right. And so he fit both of those categories?
Yes.
All right. Then the next one, cultural and religious beliefs. Believe that suicide is noble resolution of personal...
It's not relevant here.
Okay. Local epidemic of suicide.
Not relevant here.
Unwilling to seek help. Is that relevant?
No.
All right. So, more than 3/4 of the risk factors for suicide were applicable to Mr. McCord.
Yes.
Now, as a psychiatrist who's practicing, or a physician who is a medical director, like Dr. Evans was, at the Renaissance, whose task it is to ensure that appropriate medical treatment is given to a person like Mr. McCord, if you have all of these risk factors, can you share with the members of the jury whether or not seeing a patient for 15 minutes over the 5 days and then that next morning is acting within the appropriate standards of care?
It's not. It's not acting in the appropriate.
I mean, is this even close? Is it even close?
I really don't think it is. The gentleman had a lot of risk factors for suicide.
Now, when you look at the record at the Renaissance, did Dr. Evans even make a note?
No, there's no written or dictated note in any of the Renaissance file that I've seen.
Now,
Records.
in the records, we learned that the advanced registered nurse practitioner, Nurse Gleason, came in. He was there that Saturday.
Objection, Your Honor. Leading, testifying a little bit.
Sustained objection.
Yes, ma'am. Can you share with the members of the jury whether or not Nurse Gleason did or wrote a note on the day she came in, July the 2nd?
She wrote a note.
Now, if a physician reviews a note that someone else writes, if practicing within the appropriate standards, what usually occurs?
You generally co-sign or countersign the note. It's quite common to also put your own written impression at the end of the note to say, I have reviewed this note, I agree with the assessment plan as presented here, and then often you'll say in addition, and you'll do, because you're the doctor and hopefully you have a little higher level of expertise. That's not to knock nurses. Nurses are great. But that's generally what's done. At the very least, you countersign the note and you write a sentence or two showing that you've reviewed the note and you concur with the note.
In your review of this record, did Dr. Evans even countersign a note that Nurse Gleason wrote?
No.
Did you have an opportunity to read Dr. Evans' deposition?
I did.
And in reviewing Dr. Evans' deposition, did you utilize some of the testimony that he gave in his deposition as a basis for formulating your conclusions with respect to his violations of the appropriate standards of care that rose to a level of reckless disregard for Mr. McCord's life and safety and conscious indifference to his well-being?
I did.
All right. And I would like for you to, if you would, share with the members of the jury, based upon your review of that testimony, whether or not Dr. Evans indicated a knowledge of what the risk factors for suicide were.
In his deposition testimony.
Yeah.
The way I read the testimony, he lacks the knowledge of some of the risk factors, and major risk factors for suicide.
And can you practice and take care of and protect a patient who is, as you described, vulnerable and not know the risk factors for suicide?
You just can't. This is basic third-year medical student stuff. You cannot take care of these types of patients and not know this like you know your own name.